Like and subscribe for daily OT brain boosters. An occupational therapist is screening a client following a mild traumatic brain injury. During the visual alignment assessment, the therapist observes that one eye is deviated inward toward the nose, while the other eye remains in a neutral position. Which condition is the therapist most likely identifying? C. Esotropia. During a vision screening, an occupational therapist notes that a client's affected eye consistently turns inward toward the nose at rest. The therapist documents this finding as medial strabismus. What is another clinical term used to describe this condition? A. Esotropia. An occupational therapist is performing a visual alignment screening on a client following a stroke. The therapist observes that one eye is deviated outward, away from the midline, while the other eye remains properly aligned. Which condition is the client most likely demonstrating? B. Exotropia. During a vision screening, an occupational therapist observes that a client's eye is deviated laterally, away from the midline, while at rest. This finding is documented as lateral strabismus. Which condition is the therapist most likely identifying? B. Exotropia. During a pupillary light reflex assessment, an occupational therapist observes that one eye is positioned higher than the other at rest. Based on this finding, which condition should the therapist most likely suspect? C. Hypertropia. During a vision screening, an occupational therapist observes that one of the client's eyes is positioned higher than the other at rest. This finding is documented as vertical strabismus. Which condition is the therapist most likely identifying? C. Hypertropia. During an ocular range of motion screening, an occupational therapist observes that one eye is positioned lower than the other at rest. Which condition is the therapist most likely identifying? D. Hypertropia. A client is referred to occupational therapy with a diagnosis of vertical strabismus. During the ocular alignment screening, which finding should the therapist most likely expect to observe? C. One eye positioned higher or lower than the other. Like, comment, and share. Learn something or nailed it. Follow us to stay OT sharp. You got this.